But the vaccine rollout in the United States has been a dismal failure thus far. And in today's briefing, we discussed five things we'll do in an attempt to turn things around. 5 things to turn frustration into motivation. 5 things to help us meet our goal of 100 million shots by the end of our first 100 days in office. Some wonder if we're reaching too far for that goal. Is it achievable? It's a legitimate question to ask. Let me be clear. I'm convinced we can get it done. And this is a time to set big goals, to pursue them with courage and conviction, because the health of the nation is literally at stake. First, we will immediately work with states to open up vaccinations to more priority groups. The process of establishing priority groups is driven by science, but the problem is the implementation has been too rigid and confusing. If you were to ask most people today, they couldn't tell you who exactly is getting vaccinated. What they do know is there are tens of millions of doses of vaccine sitting unused in freezers around the country, while people who want and need the vaccine can't get it. We'll fix the problem by encouraging states to allow more people to get vaccinated beyond healthcare workers and move through those groups as quickly as they think we can. That includes anyone 65 years or older, a population that has accounted for over 80% of the deaths to date. 80% of the deaths to date. We also have to continue vaccinating frontline essential workers like educators, first responders, grocery store workers, etc. It won't mean that everyone in this group will get vaccinated immediately, as the supply is not where it needs to be. But it will mean that vaccines become available. As they become available, we'll reach more people who need them. We'll reach out and get the vaccine used. The second thing we're going to change, if we're getting more people vaccinated, then we need more vaccination sites. That's where we're going to harness the full resources of the federal government to establish thousands of community vaccination centers. On my first day in office, I'll instruct the Federal Emergency Management Agency, FEMA, to begin setting up the first of these centers. By the end of our first month in office, we will have 100 federally supported centers across the nation that will ultimately vaccinate millions of people. Think of the places that are convenient and accessible: school gymnasiums, sports stadiums, community centers. We've already had productive conversations with bipartisan groups of county officials, mayors, governors, tribal leaders, leaders of the private sector, who shared their ideas with us about this effort. And as we build them, we're going to make sure it's done equitably. We're going to make sure there are vaccination centers in communities hit hardest by the pandemic, in Black and Latino communities and rural communities as well. Within the first month of our administration, we're going to deploy mobile clinics, moving from community to community, that will partner with community health centers and local primary care doctors to offer vaccines to hard-hit and hard-to-reach communities in cities, small towns, and in rural communities. And to staff up these centers, we will mobilize thousands of clinical and non-clinical professionals. Think of the people that we deploy in natural disasters. Experts from the Federal Emergency Management Agency, from FEMA, and the Center of Disease Control, our Public Health Service Commission Corps, our military medical personnel, our first responders. Additionally, we're going to expand the pool of medical professionals, including retired healthcare workers, who can administer the vaccine and to ensure we have enough vaccinators to meet the nation's needs as we ramp this up. And as governors of both parties have asked, our administration will reimburse states 100% when their National Guard is deployed in the fight against COVID. We'll provide resources to help states cover the cost of personnel, vaccinators, administrative staff, as well as supplies like dry ice and laptops and protective equipment. The third change we're going to make is we're going to fully activate the pharmacies across the country to get the vaccination into more arms as quickly as possible. Millions of Americans now turn to their local pharmacies every day for their medicines, flu shots, and much more. We're going to immediately start new major effort, working directly with both independent and chain pharmacies to get Americans vaccinated. This program will expand beyond access in neighborhoods across the country, so that you can make an appointment and get your shot, conveniently show up at a particular time, and get it done quickly. The fourth thing we're going to do is we're going to use the full strength of the federal government to ramp up supply of the vaccines. As I said before, we'll use the Defense Production Act to work with private industry to accelerate the making of materials needed to supply and administer the vaccine, from the tubes and syringes to protective equipment. And I've already asked the team, and we have identified the suppliers who are prepared to work with our teams, and we're going to work with their teams. Not someday we're going to go do this. When I say we're going to invoke the Defense Production Act, I said, go out, even though we don't have the authority now, go out and identify those companies that are prepared and will be able to do what we're going to ask. As we made clear earlier this month, the Trump administration's policy of holding back close to half the supply of the vaccines available did not make sense. Our administration will release the vast majority of the vaccines when they are available, so more people can get vaccinated quickly while still retaining a small reserve for any unseen shortage or delays.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here, and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.